last lecture in Physio 1 includes special respirations. In particular, we're going to be first looking at high altitude breathing, which would be a hypobaric environment. And then we'll be looking at the effects of a hyperbaric environment, such as diving. So we're going to start first with a hypobaric environment, where the big issue as you ascend to higher and higher altitudes is what happens is barometric pressure declines, and as a result the levels of oxygen that the person is taking in is going to be an issue. Couple things to make sure you keep in mind is as we climb the higher altitudes, the barometric pressure is always equal to the weight of the air above it, but because air compresses, the change in barometric pressure per change in vertical distance is not a constant. So what we're going to be showing you a table that kind of shows you as you climb to higher altitudes, the barometric pressure really can drop off significantly. It's not a linear drop off, it can drop off quite significantly. The biggest issue that we will encounter because of the drop in barometric pressure will be the low levels of oxygen that we breathe in, and results in hypoxia. And the effects of hypoxia, we'll be discussing some of the effects of hypoxia. The one thing to keep in mind, might as well say it now, and I'll probably say it again, is the air that you breathe is a mixture of nitrogen, oxygen, carbon dioxide, water vapor, and those percentages that I made you learn for your previous exam of, like, the nitrogen is about 79% of the air that you breathe. Oxygen is about 21% of the air that you breathe. It's the same percentage. It's down here at sea level. It's the same percentage up here at the high altitudes. So you're still breathing 21% oxygen, but the issue is when we review Dalton's law, the actual pressure of that partial pressure of oxygen of the air that you're breathing is going to be significantly less because barometric pressure is going to be significantly less at the higher altitudes. Just to kind of give you a frame of reference for the altitudes, if you look at Dallas, we're at 512 feet above sea level. We're considered low altitude. We're pretty close to sea level. The moderate altitudes is between 5,000 and 8,000 feet. Denver is considered a moderate altitude. In other areas in Colorado, such as Leadville, Colorado, that's like over 10,000 feet above sea level. That's considered a high altitude. When you start getting to very high, 14,000 to 18,000 feet above sea level, like in Mount Whitney in California, that's considered very high. Extremes are greater than 18,000 feet. You'll see that in K2, Mount McKinley, and Mount Everest. Now, Mount Everest is considered to be the highest altitude in the world. It's about over 29,000 feet above sea level. Now, here's a couple books in case you're interested. They're good. They're fun. Not fun, but to me, they're kind of fun to read. The Climb by Anatoly Bukriev and Into Thin Air by John Krakauer. These books tell you about the story of the disaster that occurred on Mount Everest, where a freak storm came in and a lot of people died. The Anatoly Bukriev was one of the people that was involved in that John Krakauer talks about in this book. He was in a different group of climbers, and Anatoly Bukriev is actually the one that saved a number of climbers from the disaster. And both kind of give slightly different accounts. I tend to believe this one a little bit better because there's more backup for this one, but they're both kind of good, interesting books to read about high altitude climbing. Now here, this graph that's in your notes kind of shows you the relationship between the altitude, barometric pressure, partial pressure of oxygen, CO2, and over here is this here refers to the saturation of hemoglobin with oxygen. So here you see what you see at sea level. Now you notice once you start going to higher altitudes, look what happens to barometric pressure. They steadily decline. And therefore, because of Dalton's law, you could figure out the partial pressure of a gas if you know the barometric pressure and the percentage of that gas in the air that you're breathing. So you'll notice is the oxygen is still only 21% of the air that you're breathing, but it's 21% now here, for this example, of 523 millimeters of mercury. So what you'll notice is the partial pressure of the air that you're breathing is less than what we saw at sea level. And what you'll notice if you look at what happens in the alveoli, it's even less, because what happens is you get the humidification of air. You also, remember, get that exchange across the respiratory membrane. You'll notice there's numbers in parentheses. The numbers in parentheses is what you would see with someone who's been acclimatized to the higher altitude. What you'll notice too is the saturation of hemoglobin also declines as you go to higher altitude. Now, and pretty much in order to stay kind of conscious, you need to have at least 50% saturation of hemoglobin. Once you get less than 50% saturation of hemoglobin, usually someone will pass out. And that, I mean, that's for someone who's not acclimatized to a higher altitude. Now, the limits, or the highest altitude, is at Mount Everest, which is almost 20,000 feet. It's a little less than 20,000 feet. So you'll notice is the big issue is going to be the low levels of oxygen. That is going to be the most significant issue. Now you can have better oxygen in the alveoli and better saturation if someone is allowed to breathe pure oxygen. So by breathing pure oxygen, you're kind of taking up, reducing the amount of nitrogen that normally would have been 79% of the air that you're breathing, so you're actually displacing some of that nitrogen. You're going to improve the levels of oxygen in your alveoli, in your blood. Now obviously there may be some issues if someone breathes pure oxygen, because oxygen can have detrimental effects on the respiratory membrane. So I have not yet, still have not been able to find exactly for those people who do high altitude climbing, when they do get oxygen canisters, is it 100% oxygen or just a higher percent oxygen? But I know that those who climb higher altitudes often will use supplemental oxygen. I just don't know what percentage of oxygen that they're breathing. Now this picture was obtained from the United States Air Force just to kind of give you an idea that, or was given an idea for the pilots, that if they're in their plane and the plane suddenly decompresses, how much time that they have before they become unconscious. And it all depends on the altitude that they are. The idea is the higher altitudes that you are, if the plane decompresses, the levels of oxygen available to that pilot are significantly reduced, and so the amount of time before you lose consciousness will steadily decrease as you go to the higher altitudes. Now here, this picture kind of shows you some of the effects, acute effects of hypoxia. And you can see there can be crossover here, so it's not like you only get difficulty breathing at 20,000 feet above sea level. You can kind of get a mixture of these as you ascend higher and higher altitudes. Now this picture over here I wanted to put in there just to kind of show you that a lot of these mountains, especially Mount Everest, has become kind of environmental disaster area, because people that climb those mountains bring these canisters of oxygen and they just leave them along the side of the mountain just to litter them. And so there's an issue, is there a moral issue or ethical issue of people who are going to climb these mountains? If you can't do it without supplemental oxygen, you shouldn't climb at all. Why should you use oxygen? If we weren't intended to live and work at these higher altitudes, why even try it? Now, the book, this picture is from that book, Into Thin Air by John Krakauer, and it's very hard to see because it's, I got it from the internet, so it's kind of hard to see. But if you read the book, they'll tell you what goes along with trying to acclimate to this low oxygen environment. They start off at base camp. They spend a certain period of time at base camp, and then they go up to a first camp, set up camp, come back down to base camp. They may go to the second camp, spend a little bit of time, go down to camp 1, and they periodically will go up, come back down, and they take a long period of time from arriving at base camp before they get up to the summit of Mount Everest. And it allows them time to acclimate to the low oxygen. If they didn't acclimate, they would never have a chance of ascending Mount Everest or a lot of these much higher altitude mountains. So some of the things that allow you to acclimate to this low oxygen environment include, well, you'll notice here, one of the things in result to the low levels of oxygen is ventilation increases quite a bit, and this is alveolar ventilation. This is like pretty much right away. As soon as you go to that higher altitude, ventilation starts to increase quite a bit. Now, what happens, or one thing to kind of keep in mind, is what stimulates this increase in ventilation. It is the low levels of oxygen that are picked up by the peripheral chemoreceptors, not the central chemoreceptors. The peripheral chemoreceptors are what sense the low levels of oxygen. So that will stimulate an increase in ventilation. Now, one thing to keep in mind, though, is at higher altitudes, the act of breathing is going to use a lot of energy. And although you think, well, at the higher altitudes, the density of the air is lower, which decreases resistance, so it should decrease the work of breathing, but it's only slight. What happens is work of breathing is greatly increased when you're at the higher altitudes because much greater volumes of air are necessary to supply enough oxygen to the body from the atmospheric air, in which the level of oxygen is reduced. So you can expend a significant amount of energy breathing at these higher altitudes. Now, the other things, though, that occur during the acclimation process to the higher altitudes is the oxygen, partial pressure of oxygen will decline, which is obviously what stimulates this increase in ventilation. What results, though, is respiratory alkalosis, because you're blowing off a lot of carbon dioxide, which can result in respiratory alkalosis. Now, this can make you feel a little crummy. So this is one thing that can cause some of the altitude sickness that we're going to be talking about. Another thing that will happen is pulmonary resistance will increase because of pulmonic hypoxic vasoconstriction. If the partial pressure of oxygen in the alveoli get too low, you're going to have vasoconstriction of the vessels serving those alveoli, which can increase resistance. Now, over time, obviously pulmonary arterial pressure will also increase, and in some people who have been at high altitudes for a significant period of time, can result in hypertrophy of the right ventricle because that right ventricle has to work harder. Some other things that may happen is your oxygen hemoglobin curve will shift to the right. What causes a shift in the right is you start producing more of that 2,3-BPG, the physiologists call it DPG, 2,3-bisphosphoglycerate, which is a negative allosteric effector of oxygen binding to hemoglobin. So this allows the person to release more oxygen at the tissues. Some other things that, are listed in your notes that result from acclimation is red blood cell count increases, your hemoglobin concentration increases, the hypoxia stimulates erythropoietin, and erythropoietin stimulates the production of red blood cells. Now, this is going to take, not be immediate. So it takes about anywhere from 2 to 6 weeks or even longer for hematocrit to increase and hemoglobin to increase. So this is why some people acclimate, if they're going to climb to Mount Everest, maybe up to a month to get the optimal acclimation. The diffusing capacity of the respiratory membrane increases. You increase capillarity. It triggers angiogenesis. This is probably going to be more significant in people who are born and live at these higher altitudes. Probably not as much in people like me that maybe would go up there to acclimate to go climb Mount Everest. It's probably going to be a little bit more significant in those who are native to the high altitudes. They say you can get some cellular acclimation too, where you produce more enzymes involved in aerobic respiration, number of mitochondria. But again, this is probably more that you would see probably more significant in people who are native to these higher altitudes, rather than people like us that may be going up to the higher altitudes. What is considered to be probably the most significant or most beneficial physiologic response to the low oxygen is that increase in pulmonary ventilation. And it's pretty immediate, okay? It's not real significant right away, because you get that, because of that increase in ventilation, you blow off all that CO2, the central chemoreceptors say, hey, you don't need to breathe so much. And what happens though, you have to give it a few days, those central chemoreceptors kind of get blunted, their response gets blunted, and you can go up, ventilation can increase about 5 times normal. Now these people here, these are people who are called the Sherpas, who are native to the Himalayas. These are people who are often utilized for climbers for Mount Everest because they have been born here, they've lived here their whole lives, they're better suited to the environment. They're naturally acclimatized. So often climbers will utilize these people to carry their equipment, to set up the camps, do their cooking, pretty much do all the work, set up the ropes. They pretty much do all the work for them. Now, these people, since they're born and they've lived in these environments their entire lives, they have some slight differences to us. Their body size are slightly decreased. Their chest size is very much increased because of their major increase in ventilation. Their hearts are a little bit bigger. They're specifically their right ventricles, because the right ventricle has to work so much harder to get blood up into the lungs. They have higher red blood cell count, so the term would be polycythemia. And their hemoglobin's slightly different, and their oxygen hemoglobin dissociation curve is different. So these people are better designed to work at these higher altitudes, even for someone who's acclimatized from sea level. They will never be able to get to the work capacity of someone who has been living here their entire lives. Now, just to show you that the Incas weren't stupid, the Incas knew that acclimatation was very important, and that the Incas always maintained 2 armies. The Incas kept and trained an army at the higher altitudes, and they also kept an army at the plains. So those ones that lived at or trained at those higher altitudes and lived at the higher altitudes were better suited to the higher environment and could protect anybody who decided to kind of climb over a mountain and attack them. Now, I kind of like these next 2 pictures, in which these are photos of things on hiking trails in various mountain places, and people like to go hiking in Denver and different places, and they put this up there for people to realize there are could be problems working or exercising at these higher environments. So they list all the different things that can happen, and so people are aware of it. Now, what we're going to discuss is acute mountain sickness and chronic mountain sickness. Now, acute mountain sickness I might as well do first, and then we'll do chronic mountain sickness. I'll just kind of let you, give you a few seconds to kind of look at acute mountain sickness. We're going to be discussing this HACE, high altitude cerebral edema, and this other one, high altitude pulmonary edema. We'll be discussing those. It gives you various signs and symptoms. The idea, though, if you're struggling, you need not ascend any higher, because if you ascend too quickly, it's just going to get worse. The biggest issue for mountain sickness comes from people who try to ascend too quickly. Here's another one too. Be aware of these high altitude hazards: lightheadedness, disorientation, and it's regardless of fitness level. You have people who are elite athletes that can climb to high altitudes and be knocked on their butts. And you have people who are not elite athletes that ascend it and get up there. So it's regardless of your fitness level, these things can happen. So one of the things can happen. Would be an example of an acute mountain sickness. Generally, overall, acute mountain sickness is related to hypoxia, hypocapnia, which is low levels of carbon dioxide, because you blow off a lot of CO2, and it's resulting alkalosis. And what's going to happen is, generally with acute mountain sickness, is usually fairly early on from your arrival to the higher altitude, anywhere from 8 to 24 hours. You'll get acute mountain sickness, and it can last anywhere, 4 to 8 days. Usually it's because of a too rapid ascent. This HAPE and HAC are like extremes. These are where generally most people, they feel a little crummy, they don't feel very well. Generally what they say is ascend very slowly, avoid real heavy exercise for the first 3 days of going to the new environment. But where I'm going to list for you is kind of the extreme cases. Now, about 2% of the population that go to higher altitudes become acutely ill, can die. And these two examples are they're real bad things that people can die. And the first one is high altitude pulmonary edema. So here it's like, if you develop this, you have a 44% chance of dying from it. And this is more common than high altitude cerebral edema, or I should say most deaths from high altitude sickness will be from high altitude pulmonary edema. But also to keep in mind, the Sherpas, the Incas, any of those people who live and work at high altitudes, they still can develop high altitude pulmonary edema and high altitude cerebral edema, because they come up, they move down, they still have to ascend slowly, just like anybody else. So they can occur in these people too. They have difficulty breathing, that's dyspnea. The SOB is shortness of breath. They can't exercise as much. They're going to expend a lot of energy just breathing. I have seen a paper in which climbers have reported as taking many as 10 breaths a step while they were climbing, and the amount of breaths per step have steadily increased at the higher altitudes they go. So they expend a lot of energy just breathing, so they can't exercise as much. It takes them forever just to go a few feet. With the pulmonary edema, what can happen is they'll have a cough. Eventually, when the cough becomes productive, and what they're coughing up is like a frothy, bloody sputum. And what has happened is you get such massive constriction of the pulmonary arterioles. You can get very high pressures there in the lungs. Localized area of edema can happen because of that high pressure. And if the pressure gets too high, they have what we call stress failure. And edema fluid will increase. You get red blood cells coming out, and that's where you get the bloody, frothy sputum that comes out. If it extends to too much area of the lungs, it can be fatal. It does respond very well to oxygen therapy. The pretty much what needs to be done is it has to be treated very quickly, and so these people must be brought down to a lower altitude as quickly as possible. They will give them oxygen, and sometimes they'll also give them glucocorticoids for anti-inflammatory, for its anti-inflammatory effects. The high altitude cerebral edema, these people have an onset of ataxia. They may be in and out of consciousness, both. They kind of ataxia, kind of like they can't do normal things like button their buttons. They kind of feel like they're just like drunk. They can also have hallucinations. They're confused, and eventually can progress to coma. And high altitude cerebral edema is again caused because of hypoxia, and because of hypoxia, the cerebral blood vessels will vasodilate significantly in response to hypoxia. What can happen though is an increase in capillary pressure can result, and fluid starts to leak out into the cerebral tissues, and since it really has no place to go, it can compress the areas of the brain and lead to, obviously, brain dysfunction. Again, with this one, the people must be brought down very quickly to lower altitudes and get treatment. Now this picture shows what they call a Gamow bag. It's like a portable hyperbaric chamber where they can put these people in here and deliver oxygen at a higher partial pressure to try to force more oxygen to the tissues. And this would be something they can use until they can get people down to the lower altitudes, because sometimes up at these higher altitudes it's hard to get equipment up in there and get these people down. It's a little bit technically an issue to get people down from some of these mountains, and until they can work away getting these people down, they can put them in these little Gamow bags. This is a good time to take a break, and when we start back we'll talk about hyperbaric environment.